All right, everybody. So what we're going to do is we're going to do, we'll do belly button therapy first, then we'll do the clapping. Now, if you haven't been into the library, go to the library, go to the do-it-yourself guide, take a look at how to do belly button therapy. I'm going to stand up here and I'm going to do it and I'm going to show you, but first let me talk about it. So we know that the belly button is very important, right? All right? When you were in your mother's womb, it fed you. It also carried frequencies and vibration of love down it, into you. But it also carried other vibrations too. If mommy was stressed, that vibration went into you. If mommy was terrorized, that went into you. If mommy was happy, that went into you. If she felt peace, that went into you. You know, we have no idea, okay? Parents do not prepare themselves to be pregnant. We must know how to honor, love, and respect ourselves prior to getting pregnant, or the fetus is terrorized. Now, can the fetus speak English? No. Understand English? No. But vibration, yes. You understand vibration. You know, you feel vibration. You can feel love, you can feel anger, you can feel hate, you can feel sadness. And understand something. We are emotional beings and we need to feel our way through life. Now, I feel my way through life with everyone because that allows me to be able to work with everybody on their level, on their emotional level. Your personality, okay, is developed by the way that you process emotions or you don't. That's why everybody's different. We act different because we have different beliefs. But here's the deal. Those emotions get stored in all your tissues. If you haven't gone in and looked at the emotional chemistry of cancer, disease, and healing, okay, go in and watch that video, but you'll need to watch it 4 or 5 times because you're not going to grasp it. But that tells the story right there. So here's the deal. The vagus nerve, it's called the wandering nerve. Okay, it comes right down the side here. There's no hardly anybody that we do a thermography on that isn't totally blocked on the neck. Why is that? Well, if we can make you stress out, okay, stay in fear long enough, this becomes scar tissue, beef jerky, crystallization, calcification. So now, guess what? Your parasympathetic never gets kicked in anymore because you're always in a sympathetic state, which is in fight, fright, and flight. This will put you into a parasympathetic state faster than any supplement or any therapy on the planet. It'll take 5 to 7 minutes. If you do some stretching, which we'll do before we start, I want everybody to get up and do a couple of stretches to see how well you stretch. After we do the belly button therapy, if you go in deep enough, you will trigger the parasympathetic state and you'll be able to stretch 20 to 25% more in 5 to 7 minutes. And I love yoga. I love stretching. It's always in my room, okay? If I get up in the middle of the night, I stay up for 40 minutes and I do my whole yoga routine before I go back to bed. I stretch out. So I love yoga, but nothing works like this. Nothing will give you the stretch like this. And if you do yoga or you do exercise, or you're going to go for a Wolf non-surgical therapy, or you're going to go for thermography, or you're going to do anything, always do this. If you're in a stressful situation, always do this. Always prepare your body to trigger the what? Dopamine, oxytocin, serotonin, and endorphins. Did you know that when you do this, you release, okay? You release 70% of your oxytocin. 50% of what? Your serotonin. That's right. Nothing else does it, and it does it in 5 to 7 minutes. If you do this at about a medium pressure, okay, and you bring up your temperature by 1 degree, It's enough to knock out any viral problem. If you go more aggressively as time goes on, you'll bring it up 2 degrees, and guess what? It's been scientifically proven if you can bring the temperature up 2 degrees, it effectively goes in and halts cancer, or goes in helping to reverse it. Now, let's remember something. Cancer patients usually don't get better because they can't get into a parasympathetic state. Your body cannot heal unless you're in a parasympathetic state. Your body cannot heal unless you are in the present moment connected to your breath. And you're never going to do that in a sympathetic state when you believe that there's a tiger after you. And most people live like that all the time. Okay, now whether you want to believe this or not, wait till we start. You'll see how much inflammation you have and how many adhesions you have when we go to do this. Some of you are hardly even going to be able to do it, and it's going to hurt so much. You're so full of bad bacteria, fungus, and gas, okay, that your intestines are inflamed and you don't even know it. Just by doing this will help to bring down the inflammation, okay? Because guess what? Are you ready? Hormones travel at the speed of light. One of the ways we know that is with an orgasm. Boom! Whoa, where'd that come from? So, same with relaxation. Once you, okay, so believe it or not, the main trigger for the vagus nerve, which is called the wandering nerve, is your belly button. Okay? All right? Okay. So, let's put our little belly button buddy into our belly button. Okay? All right, so now what we're going to do is just gently pump. Now when you're pumping, try to keep a slight smile on your face. That helps the whole parasympathetic thing. And I want you to try to connect to the Lionheart breathing, 6 seconds in, 7 seconds out. So let's just do that for a couple of seconds, okay? Just get used to it. Just get used to it. You'll know when you've been doing belly button therapy for a while. Watch this. I'm touching the back of my spine. Okay? So, you'll know when you have been swallowing things that you can't digest on an emotional and physical level when it's tender. Okay? So we're just going to get used to that for a little bit, that little bit of pumping. Connect to your breath. Where's your slight smile? It really helps. You know what? Who's he to tell me to smile? Nobody told a joke. I'm not going to smile. I got nothing to smile about. I only smile when I'm happy. Nobody gave me anything. Okay. So let's start off here, and then we're going to drop it. Well, let's go a little bit deeper. Can you feel it? Feel it working? Feel it working? Now, when we drop it, come up and pull. Okay. I did a surgery that I don't know if I regret it, but I wouldn't have done it. And, I had a vasectomy, and I could feel exactly where I got the cut. And I still had scar tissue there. And when I went like this, it was pulling and burning. And I went, oh, I better take care of that one. Right? So when you go like this and you feel a pull, you could feel a pull here if you've got a cyst on your ovary. You could feel a pull where there's an adhesion. You'll feel a pull where there's a calcium deposit. So you want to mark the areas where you feel different pulls or different things. We want to know that because once we do this routine, we'll go back with our little belly button body and go work right in on the area. But first, let's just do this, okay? So let's go up. So you don't have to be as aggressive as that. Just be gentle the first time. But see how I am? Don't like this. We're doing it like this. So we're pulling up, right? Feel it? Okay? All right? So from there, we're going to swing it to the leg in line with the shoulder. So now we're working on releasing from the appendix, okay, coming up to the stomach, okay, and the pancreas area. So now go that area as he burps. And look at it.
Left side or right side? Left side.
Yeah, so you're on the right side. Then once you've done that, just work it, work it. Don't be shy. Keep it in your belly button, okay? Keep it in your belly button. And then we're going to come over and we're going to go straight across. Now we're going to angle a little bit and keep it in the belly button. Watch. Okay? That's all it is. Okay? Once you've done that, then we're going to come up and now we're going to angle from the right shoulder down to the left leg. So now if you had a gallbladder problem or a liver problem, you might feel it, or if you have a sigmoid problem, you might feel that here. So it all depends. Okay, and we're going to do that for a few minutes. Then we're going to come and we're going to come down. Now back into the belly button. And we're going to come down. Look. Some of you might feel if you had heartburn, a little bit of hiatal problems, you'll feel a pull here. Okay? So you might feel a pull there. Okay? Or if you've got an adhesion in your small intestine, you're really going to feel it now.
Okay, to do this lying in bed.
Yes, you can do it lying in bed, and don't be afraid to do it lying in bed. You don't have to do it standing up. And that's why mine is right here. So what I do is that I do the belly button first thing in the morning, last thing at night. You want to go to sleep? You want to sleep great? Yeah. Okay? And before I do the clapping, which I do every other day, I do an hour every other day. Okay, and I mainly focus here on my neck, my face, and my head. You have no idea. And wait till you see all, you're going to go, oh my God, he's abusive. No, I'm not. I've been clapping for years now, and I go and I release all the tension. I'm not keeping it. You know, running this place, you know, why would I keep the stress? I'm going to get rid of it. Did you know you can get rid of any physical block? Just got to work on it. So what you want to do is once you get the non-surgical work, get in there with the clapper. Get in there with the shot glass. Okay? All right? And we'll show you the shot glass work as well. Where was I now? I can't remember.
Down, straight down.
Straight down. Straight down. Yeah, straight down. So now we're going to come over shoulder to leg, and we're going to do the same thing. If you think, okay, now right now I'm feeling it right here. Right? So there's something going on. So that means that I'm going to get a little bit of deep tissue right here, right? I'm going to get them to work here. It's just right there, my pubic bone. And I can feel it. Yeah, there's a little scar right there. I got it. It's a cord. So I got to get rid of that. Okay? There it is there. No, I'm kidding. Okay. And I can feel it just doing this. It's like this tickle tingling. It's like, ooh. Okay. All right. Okay. Then we're going to come over here to the side. And we're going to do the same thing. Right? Did you do any exercise prior to see if you... Okay. When you get your own, do it, and you'll find out I'm right. It's 20 to 25% more stretch. So if I was going to go play sports, or I was going to go swimming, or I was going to do anything, what if I did this? I'm not going to tear out, right? Because most people, by the time you're your age, are beef jerky, right? Okay. So I'm really working it. Then we're going to go from the leg to the up to the shoulder, right? So now wait, we're not going to go everywhere yet. Hold on, please. Okay, let's just stick with me. Stick with me. Try to focus. Try to focus. Let's keep going. Okay. So we're going to go on an angle up, and then we're going to what? We stopped here. So we're going to go here again, and then we're going to come back, and we're going to finish with this. Now look at how deep you can go. Feel how deep you can go. Look. All right, just breathe it. Now, whether you know this or not, you just did the most beautiful abdominal work on your core. You do, and I'll tell you something. If you get stressed out or something, you heard, oh, Uncle Harry, I just heard he had a heart attack. Instead of you having a heart attack, connect to your Lionheart breathing, put a slight smile on your face, do your belly button therapy, and stay in the present moment, because nobody said you had to suffer for Uncle Harry. All right? And who liked Uncle Harry anyway? No, I'm kidding. So understand something. Learn to be loving to yourself. Try to keep yourself in the present moment. Okay? So now I know that I had a problem right here. So I could take this, but I wouldn't. I would actually just get one of the therapists to take their elbow, and it would take them 1 minute, and they would unleash this for me. It would be gone. Okay? All right? It would only take them a minute, and it's gone. Wait till you see, once you've gone through the non-surgical, you're going to be like, yeah. So let's let all the, okay, so here's what we're going to do. When you go through the non-surgical and you learn that, and somebody goes, hey, are they limping, or they're a friend, or something's going on, what I want you to do is I want you to do this. It's called a spot check. You are not going to work on them for more than 3 minutes. And in 3 minutes, you'll do more than everybody else has ever done. Am I right or wrong? Guys, have you done it? Yeah. Absolutely right. So, and then guess what? Don't do any more than that. And you are not going to work on people for free, because you're going to be the best body workers that this planet has seen. And I mean it. And you know what? I can put my money where my mouth is. We offer that money back guarantee.
What's the easiest part to do a spot check on?
What?
Right here.
Right on the neck area?
Yeah, well, yeah, there's the knot right here, but it could be anywhere. The knee, could be the hip. You know, once you know how to do it, come on. You know, oh man, I've got sciatica. All you know is you go to the SI joint, clean around it for 2 to 3 minutes. They're gonna go, whoa, that's great. Yeah, okay. That's how that works, okay? So now that we've done the belly button therapy, let's move on to clapping. Okay, buddy, he's got it. Gad, please. Thank you. All right. Okay, now, that was the easy part. Everybody has been taught. Okay, everybody, can we just, we're running out of time here. And please, if you need to talk, please leave the tent. That's okay, and I don't mind you leaving. Okay? So, we have all been taught to do what? Run away from pain. Pain is an enemy. Pain is not your friend. Yes, it is. Pain is a GPS. When you feel pain, you need to be trained to know how to go in and get rid of the block. There's not one block in the human body, okay? Every block creates pain. All pain, okay, when you've got pain, you got a block. When you have no more pain, you have no more blocks. That's it. That's it. And just remember something. You had a block here before you had a block here. That would make you a blockhead. No, I'm kidding. So, now, understand this. If you don't want to remove a block, and what is a block? A pimple, a boil, a cyst, a fibroid, a tumor, scar tissue in the knee from surgery, or scar tissue from a sports injury. And understand something right now. You do know that every injury that you ever had that caused you to limp, or it hurt, or you had it for a few days, you have massive scar tissue there still. And that's what we call old age. Old age is just the accumulation of scar tissue. So you can get older, but you'll never be old. I'm telling you the truth. When I'm 95 years old, I'll still be more flexible than most 35-year-olds. Because if I've got rid of the scar tissue and I put the displaced calcium back into the bones and I've melted the crystallization in my body, then what's the difference? What's the difference? So I know young people, and I know people that are in their 20s that are limping already. I know people that are in wheelchairs that should never be there. It's all mistreatment, not treatment, mistreatment. Because people are not trained. They're not trained to master their thoughts, to master their mind, to master their body. So then what happens is, guess what? You go to what? Okay, just know this. The practitioners out there turn the burner down, but do they actually turn people around? If that was true, then why do we have all these limping people? Why from the cane to the walker to the wheelchair? Are you kidding me? Why all the drugs? If we're that good? Well, because guess what? People will come to you for treatment, but don't you keep treating them, you train them. And you also, if you get rid of their scar tissue and you restore the calcium back into their bones, and then you teach them how to love and live, that's it. And don't you worry. And do you know what most practitioners worry about? I don't want to get people well too fast. I'm going to run out of clients. My God, we're running out of time. We're running out of time. The human race is running out of time. One love, one law, that's it. We are not out to treat, we're out to train. So that's why what happens, they come, can we not clap? So when somebody comes to you for a treatment, you treat them. But then you let them know, you can keep coming for treatments, but what if you were to come for training? What if I were to teach your husband and you how to work on each other? Right? So then they're going to come to you from anywhere from 5 to 10 days. So now you're going to see 2 people, right? Or you might see a whole family like we do, 4, even up to 8 people will come for a training. And the reality is this. They're going to come from anywhere from 5 days of training to 10 days, depending on what you're working on with them. But you just gave them their life back. You gave them their power back. Seriously. Don't get me wrong, guys, but we all know the people that go, listen, if you'd like to buy us a 6-month or a year package of treatments, we'll give you a discount. We know who those people are. What are you, like crazy? If you're coming to us for more than 3 months and you haven't had amazing miracles happen, what are you still going for? Okay, we're not out to actually maintain people. Okay, we're out to master, teach people how to master themselves. That's the deal. Don't look for treatments, look for training. And that's why you want to become trainers. You want to go out and train. Look, right now, Sage has about a dozen people waiting for him to travel the world to train them, whether they're families or clinics, you know? And once this all opens up, did you know that we were booked 8 months in advance for this? Because people are starting to get it. I don't want to maintain things. I want to get rid of them. I want to be in control. I don't want to go from treatment to treatment. Oh, I only feel good until I need my next treatment, right? The whole system's broke. It's broke. And I promise you, you're going to go, well, geez, if I train them, they're not going to come back. Are you guys like crazy? They're going to tell people, wow, because they've been everywhere else. You were the last on the list. They did the chiropractor, they did the physio, they did the massage, they did the acupuncture. How many people know I have a doctorate in acupuncture? How many acupuncture needles do you see me using? I'm done with the pin cushion. I'm over it. I'm not telling you to do it. Helps, but the reality is this: nothing works like the non-surgical. So just breathe when you go through this course. Just relax and just mind your own business. Listen to it. The trainers are great. Okay, they're great. I mean, when you get done, you're going to do things on your family, your friends that nobody else has been able to do. I make you that promise. But let's talk about this. So, clapping. You see the small edges here? That's called chipping. And if you want to get a clapper, you can order them here. And if you end up going home, you just have to look on equipment. That's where we have all our equipment, like our belly button, okay, and our clappers. So this is called chipping, and this is called chopping. So a smaller area, if I had arthritis, I could go right into the joint and do chipping. if I had a place here and I wanted to chop, or I needed to chop down here because there's a calcium deposit or there's a knot. Now we're also going to teach you how to do the shot glass. This is to work on yourself, because most practitioners, let's say you leave here and you learn how to do the Wolf non-surgical, but nobody can work on you. Well, you're going to need to know this stuff, right? So today, so what you want to do is go to clapping, okay? Clapping for health, right? Clapping for life, clapping for health. It's in the library, in the do-it-yourself guide. There's so much video in there. I show you how to do the whole body. Eventually, I'm going to do a master class. It might happen this summer. But anyways, what was I going to say? Today, we're going to do just one thing, okay? And okay. Yeah, we're live. We can do it if you want live. What's going to happen is I need people to, like, this is the way you clap. You don't put it up here. You bring your hand back here, and you're not using your, you know, your whole arm. It's just like this. And it's like your heartbeat. 1 second, 1 second. I know you're excited. I get it. I do, I get it. And what you're going to do is you're going to start clapping. Where are you two from? What's the country? What? I should have known. I'm kidding. Okay, all right, so when well, you're going to want to go with the smooth side first. When I do it, I always do the bumpy side. Now I'm just going to show you, because we're not going to do this whole thing. I promise if you want me to show you, if you guys decide during this training, I want you to show me how you would do the whole body. It'll take me about 45 minutes to show it. I'll do it this week, okay? It's on my website, but if you want to show me in person, I'll show you how to, I would do it, okay? But I'm going to show you, and this is the truth. This is how I do it. For when I do, like, I'll start right here. And everything has got to be done on the skin, not through the clothes, okay? So just leave, who cares about the shirt right now, but I'll start here, and I'll work on my parasympathetic and my neck, right? And I work that hard. Now, is it stinging? Yes. When I first did it, I could never do it that hard because it was physically abusive. See, it's a thought thing, right? It's a thought thing. So I get it. So most of you are going to do this. You're going to pretend, right? I get it. I will be walking around and catching you. So when I do it, I use the bumpy side, but I'm just going to show you how I do my neck, and I'll get around, and I'll do the back here. The occiput's always important to do. I'll do the back of the neck, and then I'll do up here, and I'll do behind. You see, I'm not wincing, am I? Because I know the pain that I'm creating is creating a healing. I used to get terrible migraines when I was younger, and when my kids were young. Every week, they'd knock me down for 2 days. I would have to take all kinds of pain medication to power through work, right? Okay, I did when I went mountain climbing once, I cut the side of my head really bad, right down to the bone. And I was about 10,000, 11,000 feet up. And we had to use fish wire to sew it. It's about this long. And what happened was, when I went down, they had to re-stitch it. And then when I went home, they didn't get all the stitches. So it was in there for another 3 years. I had so much scar tissue. There was like a big bump. And I was getting these migraines all the time. But once I got the non-surgical done, Sage would work on it. You know, I mean, this was years old. And then when I got into the clapping, that's when it really pulled it together. And I'd go in there and I'd clap it hard every night like this. And then I'd use the chopper and I'd go in here and I would pull it apart. And then he would also work on it. And then I would get the headaches right up in here. And I clap like this, watch. See, now that, you wouldn't do it. You couldn't do that. You see how I'm in control? You see how I master pain? I'm not wincing, am I? No, because everything's a program, okay? You are taught to run away from pain. When you feel pain, that's a bad thing. Not when you're the master of it. Okay, so now, right now, this is all warm, tons of circulation. That's what it's all about. If you don't have circulation somewhere, or you've got swelling, or you got stiffness, okay, or you got redness, you've got a block. Oh my God, I gotta go see a doctor. Go to see a medical doctor who's gonna give you drugs. That shuts off the pain in your brain, but the pain and the damage is still going on. And it's only gonna get bigger, 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 the problem, until you gotta go to surgery. Then after surgery, you get to do more drugs. Then from the surgery, you get more scar tissue. Then from the scar tissue, now you get to get an implant, a new hip, maybe a rod, maybe a screw, maybe a plate. You see, that's how bad this goes. So, and then I always use the bumpy side, and I will. I mean, I do it until this part of my body says, you did it. That's what we want to do. Bring up that vibration. Bring up that circulation. Bring up that warmth, okay, all right? How warm is a dead person? Okay? How warm is a sick person? They're always cold, okay? But there's certain parts of their body that are on fire. So when a person has a fever, they're trying to burn infection. And that's another thing. Why wouldn't you, if you had a fever, give yourself an enema and bring the fever down? Why'd you just lay there in bed? Ugh. Why would you do that? So how do you turn the burner down? Okay? All right? So you either do therapeutic vomiting, if you can catch it in time, that if it's in your stomach so it doesn't get to your small intestine, which we're going to be talking about. Therapeutic vomiting is a lifesaver. And you know how you feel sick to your stomach and you're not sure why? Well, that's because it's emotions that are trapped. And if you do therapeutic vomiting, you might have to do it for 3 or 4 days, maybe 5 days. And guess what? It'll save your life. Where's Sharon? Hey, Sharon? Yeah, and a whole bunch of other people know that here. Therapeutic vomiting will save your life. You know, why would you stomach it? I can't stomach it. Really? Yeah, then don't. But we'll talk about that later. So anyways, so I'll clap I do like this. I'll do here, back here. I'll do up here thoroughly. Then I'll do here. And understand something too. I have 20% more hair on my head than I had before I started clapping and using Avicen. Your hair will grow back if you use an Avicen and you use a clapper, okay? And if you use like the Hair Restore, and also C60 is really good for eyesight, hair, hearing, things of that nature, okay? All right, so what we're gonna do, because we can get into this deeper throughout this training if you want, or just go to the videos and watch them and train yourself, okay? You know what? People that are, like you take Ramana. Now Ramana, she went through everything. She couldn't get here for 2 years because of the whole C thing. So she went through everything and started doing her own consultations without me. She still owes me for that. I have to have 20% of everything she'd made. But, so, I'm kidding. So the reality is, if you're not a self-starter, if you aren't going to take an hour to 2 hours every day and do research and training, you're never going to be that good. I've always told my kids, just do 10% more than anybody else in the class, and everybody will say you're a genius. All right, so we're going to start, and all you're going to do is you're going to pick your elbow. Now, one second. I know we're really excited, aren't we? Okay, can't wait to clap myself. Okay, so this here is the lung-heart meridian. We're going to clap for 10 minutes. I want you to connect to the lion heart breathing. I want a slight smile on your face, okay? All right? And I want you to breathe. Now, Raf, we're not going to make people just listen to the clapping. So what we'll do is we will end this, and then we'll come back on and we can talk about it. How's that? All right? Raf, is that good with you? Okay, so everybody out there, we're going to stop now so I can focus on everyone here. So let's end this, and if you want to come, we'll be back in about 15, 20 minutes, and we'll have people come and talk about it, and those who want to show it. Now listen to me, everyone. Dedicate yourself to this. Let me explain what's going to happen. How many people here have had a broken heart? How many people have had a broken heart many times? Okay. So how many people here have had breathing problems? Okay. So what you're going to do is, when you start clapping here, you're going to see just red if you're completely healed. But you've got to do it like this. Now what you do is, it's not pain, it's therapy. And you breathe and you smile. And you got this. Just say, I got this. So we're going to do it for 10 minutes, and I mean 10 minutes. You're going to see people that you're going to see green, brown, light purple, dark purple, and you're going to see black. Now, of course, the darker it is and the more you have, the more lung damage and heart damage you have. You're not going to believe this, but by doing this, we're repairing our lungs and our heart. Yeah, welcome to real healing. Now, people that actually bruise without banging into anything are dying. See what I said? The black and the blue, the green and the brown that come to the surface is contamination in your cells, and it is tissue rotting. When you do this, you're bringing the tissue rotting, the contamination, and the infection to the surface. You did not bruise yourself. You will find out when you work on people the way we do our technique, it is impossible to bruise a healthy person. If you ever work on anyone with Wolf non-surgical and they bruise, don't scare them. Tell them that, guess what? You've infected yourself emotionally and nutritionally for a long time. Alcoholics, people that do a lot of prescription drugs, and drugs will bruise easy. Okay? People that have a very congested liver and have backed up their bowel will bruise easy. This person will bruise easy, even if they eat right. I'm sensitive. Okay? I pick up everything. I'm an empath. I feel everything. I'm not insensitive, but I don't take on people's suffering. If you are sensitive in the way that you take on people's suffering, you will damage your health. You will bruise easy. Okay, how many people in here have their feelings hurt easily? I know you're not going to put your hand up. Well, we got two. Those are Susie Bruisies. Okay, and they're also not the, okay, so Christian, okay, and Elizabeth back there, nobody date them. It's going to be a big problem. I didn't mean, why did you say that? What did I say? You know what you said.
It was before.
What?
It was before.
Before what?
Before the course.
Oh, before the course.
Yeah.
Okay, who wants to date them? All right, okay. All right, so let's cut the show. Here we go. So 1 second, I'm going to set the clock. Now, understand.